Medicaid programs as our webinar presenter. Priscilla, you may begin your presentation.
Thank you so much, Connie. Thank you all so much for joining today's webinar. We will be discussing the Public Health and Clinical Data Registry Reporting. There are 3 learning objectives for today's webinar: to understand the Public Health and Clinical Data Registry Reporting requirements for the Medicaid PI program, to understand the differences in Objective 8 Public Health and Clinical Data Registry Reporting between Program Year 2019 and Program Year 2020, and also to learn about Arizona's Public Health and Clinical Data Registry Reporting documentation requirements. The objective of this measure is for the EP is an active engagement with a public health agency or clinical data registry to submit electronic public health data in a meaningful way using the CERT, except where prohibited and in accordance with applicable law and practice. Measures. An EP must satisfy 2 of the 5 measures for this objective. If the EP cannot satisfy at least 2 measures, the EP may still meet the objective if the EP qualifies for exclusions from all measures the EP cannot meet. An exclusion for a measure does not count towards the total of 2 measures. In order to meet this objective, an EP needs to meet 2 of the 5 measures. If the EP qualifies for multiple exclusions and there is only 1 available measure remaining, the EP can meet the objective by meeting the remaining available measure or meeting the applicable exclusion. Available measures are measures for which the EP does not qualify for an exclusion. An exclusion for a public health or CDR reporting objective does not require the EP to submit data to the registry. However, the EP must have a qualifying reason for taking the exclusion, as shown on the CMS specification sheet and referenced in this presentation. Jurisdiction. So we're going to go over a few definitions. So the first one is jurisdiction. The definition of jurisdiction is general, and the scope may be at the local, state, regional, or national level. The definition will be dependent on the type of registry to which the EP is reporting. A registry that is borderless would be considered a registry at the national level and would be included for purposes of this objective. Production data is data generated through clinical processes involving patient care. This term is used to distinguish between live data and test data, which may be submitted to test electronic data transfers. Bidirectional, this definition term only relates to Measure 1, and is when the EP is able to receive and display a consolidated immunization history and forecast in addition to sending the immunization record. So data is flowing in both directions. Active engagement. The EP is in the process of moving towards sending production data to a public health agency or CDR, or is sending production data to a public health agency or CDR. There are 3 levels of active engagement that are outlined on the following slide. Active engagement option 1. So that is when the EP has completed registration to submit data. The EP is registered to submit data with the public health agency or, where applicable, the CDR to which information is being submitted. The EP must register no later than 60 days from the start of the PI reporting period. Registration is allowed prior to the PI reporting period. The EP is awaiting an invitation from the public health agency or CDR to begin testing and validation. This option allows EPs to meet the measure when the public health agency or the CDR has limited resources to initiate the testing and validation process. EPs that have registered in previous years do not need to submit an additional registration to meet this requirement for each PI reporting period. If the EP plans to attest to a new public health measure, the EP will need to register with the registry. Keep in mind that the 60-day period discussed for active engagement option 1 does include the first day of the reporting period. And in a few slides, we will be discussing additional information if the EP is in active engagement option 1 with the Arizona Immunization Registry, which is Measure 1. Here's just a few examples of what dates would be sufficient for an EP meeting active engagement option 1. We're just going to go through the first 2 examples. So the first one shows that top row shows the PI reporting period from January 1st to March 30th, 2020. So that deadline to complete registration would have to be within 60 days of the beginning of the PI reporting period, which is going to be February 29th. So say registration for this EP was completed on January 2nd. That's 2 days from the start of the PI reporting period. So therefore, registration requirement is met for that within that 60-day period. The second example is that same PI reporting period, however, and the deadline to complete is the same as well. However, this EP for the example completed registration on March 5th. That is 65 days after the start of the PI reporting period, and therefore the EP does not meet it for that PI reporting period. So make sure that if you are on active engagement option 1, that you register no later than 60 days from the start of the PI reporting period. And that 60-day period includes the first day of the reporting period. So active engagement option 2, which is the testing and validation phase of where the EP is. So the EP must respond to requests from the Public Health Agency or the CDR within 30 days. Failure to respond twice within a PI reporting period would result in that EP not meeting that measure. So if that Public Health Agency reaches out to you, you need to respond to them and provide them whatever they're requesting during that testing and validation phase. Active engagement option 3 is the production phase. It's when the EP has completed testing and validation of electronic submission and is currently electronically submitting production data to the registry. Just some general information, EPs who have previously registered, tested, or begun ongoing data submission to a registry do not need to restart the process beginning at active engagement option 1. So for example, say you've already registered with that registry and you're in active engagement option 1 and that was in a prior calendar year. You don't need to go re-register again in 2020 to show that. You can just show that you're still in the registration phase. The EP may simply attest the active engagement option, which most closely reflects their current status. A provider can meet the measure by using communications and information provided by one of those registries to the EP that is reported individually or at the group level, as long as the EP is contributing to the data reported by the group. If an EP is part of a group that submits data to a registry, but the EP does not contribute to that data, the EP should not attest to meeting the measure, but instead should select the exclusion or select a more relevant measure to meet. If in a normal course of his or her practice, an EP does the action that results in data for a registry and is in active engagement to submit to that registry, but simply has no cases for the reporting period, the EP is not required to take an exclusion and may attest to meeting the measure. So definitions of documentation terms. So EPs are required to upload documentation for each measure. For active engagement documentation, the information listed on slide 13 should be included in all documentation submitted to support active engagement for applicable measures. For the exclusion documentation is if the EP attests to mean exclusion, the EP should submit documentation to support the exclusion. So what type of documentation? Documentation to support each measure must be submitted, and it should include the following: screenshots from the CERT or registry letter or emails to support that the EP is in active engagement with the applicable registry. The documentation submitted should include the provider or practice name. It should reflect the EP's level of active engagement, so that active engagement option 1, which is registration, 2, which is testing and validation, and 3, which is production. The documentation should be clearly legible, and it should reflect the date the requirement was met. Documentation must prove that the EP's level of active engagement was met. Documentation must be dated to show when the active engagement option 1, 2, or 3 milestone was achieved. So the requirements of the dates. The active engagement option 1, the completion date can occur before calendar year 2020 if the EP has not progressed and is still in active engagement option 1, but no later than 60 days from the start of that PI reporting period. For active engagement option 2, the completion date can occur before calendar year 2020 if the EP has not progressed and is still in active engagement option 2, which is that testing and validation phase. Active engagement option 3, the completion date can occur before calendar year 2020 if the EP is still in active engagement option 3. So just keep those dates in mind and make sure you're checking to see where you are during that PI reporting period and what phase you're in. Here's just a summary of Objective 8. You can see on the left-hand side underneath the objective, it lists the 5 different measures underneath this objective. The first one is the Immunization Registry Reporting. All EPs can be in compliance with this. The EP state exceptions, that middle column, it shows that there are no exceptions in the state of Arizona. There are exclusions available, and so that's for Measure 1. And then for Measure 2, Syndromic Surveillance Reporting, all EPs can be in compliance. The exceptions for Arizona EPs, so keep in mind that the Arizona Registry is not accepting data from EPs for the syndromic surveillance. And the same goes for the next line down, which is the electronic case reporting. The registries in Arizona do not accept data from EPs, but exclusions are available, and we will discuss those exclusions in more detail. For the fourth measure, which is the public health registry reporting, so the second to bottom row, Arizona does have a cancer registry. However, they only accept it from data from certain EPs who either a dermatologist, gastroenterologist, and list those different specialty types at the bottom of this slide. Another exception, so for Arizona EPs that have less than 100 cancer cases, the registry does not accept data from those EPs as well. Okay, and then the last measure is that clinical data registry reporting. There is, later on in the presentation, we're going to show you a list of clinical data registries that are available just in the United States. Arizona does not have their own specific clinical data registry available. So for exclusions, EPs are not required to submit data or meet the measure. However, the EP must submit documentation of how he or she met the exclusions that are claimed. Exclusions for Objective 8 are the EP does not administer to that population for the appropriate registry. The EP does not diagnose or directly treat reportable diseases collected. The registry is not capable of accepting data in that jurisdiction. The data is not collected in that jurisdiction, and the registry has not declared readiness yet. And we'll go over those exclusions in more detail later. This is another general overview slide of Objective 8. As you can see in that third column, Exclusion 1 Immunization Registry, if you go down, you'll see on that second row, it says do not administer, which means EPs are allowed to take the exclusion for immunization registry if they do not administer immunizations. However, you can see in red that it has an X next to registry not accepting data and then a red X next to readiness not declared. So those two exclusions are not available to EPs in the state of Arizona because the immunization registry is accepting data. And they have declared readiness to accept data. If you go down to that bottom row, you'll see that this is specifically related to the state of Arizona, so it's showing that in Arizona, EPs can claim that exclusion for do not administer immunizations, but they can't claim those other two exclusions for registry not accepting and readiness not declared. So as you can see, that top row is kind of explaining and listing all the exclusions that are available to EPs throughout the United States. However, that bottom row is showing what specifically relates to Arizona EPs. So if you go to that third column, which talks about syndromic surveillance, it shows that an EP is able to claim all three exclusions, potentially as long as they meet the requirements. Same goes for electronic case reporting, as well as public health registry. But under that public health registry, which is the second to last column, it does show that there is a cancer registry in the state of Arizona if the EP has less than 100 cases for cancer or does not fall underneath the 7 specialties that are allowed, then that EP can claim that exclusion for the cancer registry. But you need to make sure you're meeting those exclusion requirements if you're claiming that exclusion. A reminder, EPs must research other registries at local, regional, or national level related to their specialty or scope of practice. So the EPs in the state of Arizona can't just look in the state of Arizona for public health and clinical data registries. They need to go and search broader and try to find a registry to submit data to before they're able to meet the exclusion requirements. In the last column, you'll see for clinical data registry for the state of Arizona specific details, there is a link that CMS approved quality clinical data reporting registries for 2020. There's a list of registries there that fall underneath the clinical data registry measure. So EPs, we highly recommend that EPs go there to check and confirm that they can submit, or they can or cannot submit data to any of those registries listed. So let's move into the specifics for Measure 1, which is the Immunization Registry Reporting. This is just a brief overview slide related to immunization to help EPs kind of start to figure out where they meet, where they fall for this measure. So for step 1, you want to look at the measure results. So does the EP meet the requirements? Do they submit data to the registry? Okay, so that moves you over to the left, that circle that shows met. And then you go down, it shows the measure was met. Okay, but if we start back up under measure results, and if we go to the right into that burgundy circle, you can see that it says not met. So you don't meet the measure. You don't submit immunization data to the registry. So let's see if an exclusion replies. Okay, so let's look at the exclusion results. So if you go down to exclusion results, and then we go over to the left, which shows, hey, you meet one of the exclusions. Well, what are those exclusions? So we're going to go down into the middle where it shows 3 different boxes. So that first one, it shows do not administer, which is allowed for EPs in the state of Arizona. If they do not administer immunizations, then they do not have to submit immunization data because there is no data to submit to the registry. However, as you can see, there's a red line going through registry not accepting box and the readiness not declared box, because EPs are not allowed to claim those exclusions in the state of Arizona because the immunization registry is accepting data from EPs, and the immunization registry has declared readiness to accept that data. So in that scenario, there's only one exclusion that can be met. Going back up all the way to the right, you can see that the EP does not meet it, and therefore should the measure and exclusion not met, so they should select another public health measure to report to. So you can kind of walk through this slide to try to figure out, should you use Measure 1 as one of your registries? Because you only have to submit data to 2 registries to meet this objective. So most of the EPs are familiar with this immunization registry. The only thing that really changed is that the immunization data must flow bidirectionally now between the CERT and the Arizona State Immunization Information System registry to meet the measure. So that data needs to flow in both directions now. Okay. EPs must submit doses administered and query with the Arizona registry in real time for consolidated records and forecasted immunization due at the point of care. An EP CERT may layer additional information on the immunization registry forecast and still successfully meet this measure. EPs should ensure that the CERT has the capability to exchange data bidirectionally with the registry, and EPs should verify with their vendor that they have bidirectional capability, and reach out to the Arizona Immunization Registry, letting them know they are moving to bidirectional capability. So if you've not already moved to bidirectional in a prior program year and met the requirements, you need to make sure you're reaching out to your CERT and confirming that you can submit data between your CERT and the Arizona Immunization Registry, and you need to reach out to the registry to confirm that data is being submitted bidirectionally. EPs can test the bidirectional exchange with the registry. Keep in mind that non-vaccinating EPs can meet the measure if they query and receive results from the registry and integrate the data into their CERT in accordance with HL7 version 2.5.1. An EP must have reached out to the registry during program year 2020 or earlier to request bidirectional data exchange. Previously registered EPs with the registry do not need to register again to exchange bidirectionally. Reach out to the registry once the EP is ready to begin bidirectional exchange, and then the EP will move to active engagement option 2, which is that testing and validation phase. For newly registered EPs, active engagement option 1 is only available in program year 2020 for EPs who have not previously registered with the registry. There are 2 options for EPs registering in program year 2020. The first is that the EP can register to submit data unidirectionally. However, once the EP moves through active engagement options 1 and 2, the EP must immediately request to start exchanging data bidirectionally. Or the EP can go ahead and request bidirectional data exchange during the initial registration process with the registry. And Access does recommend this last option because you just go ahead and take care of it at once and make sure when you go to register, you're also requesting bidirectional data. There are no changes that occur between program year 2019 and 2020. So just the exclusions for the immunization registry. We did discuss that exclusions 2 and 3 are not available to EPs in the state of Arizona, but exclusion 1 is. So exclusion 1 is when he or she does not administer immunizations to any of the populations for which data is collected by the jurisdiction's immunization registry or during the PI reporting period. Documentation for the immunization measure is for active engagement documentation. Please look back at slide 13. Which just lists the 4 items, which are listed here as well, but you can include it should include the provider or practice name. It should reflect the EP's level of active engagement. It should be clearly legible, and it should reflect the date the requirement was met. And you can look at slide 14 for those date requirements. For the exclusion documentation, so only exclusion 1 is available. So the document should explain and Document why the EP does not or is not required to provide immunizations in his or her jurisdiction. For example, an EP submits a signed letter on the practice letterhead explaining why he or she does not administer immunizations. One example would be if you're a dentist and you do not do those immunizations. So just write that down, explain it in a letter on your practice letterhead, and make sure to submit it during attestation. Here's an example. It's an email. It just explains that the registration of intent has been successfully submitted to the Arizona Department of Health Services, and it shows a date. So that would be sufficient to show you're in active engagement option 1. This example right here also is another email that just explains that they are ongoing. They're submitting data currently. And so it even goes back and identifies when that registration date occurred. And this would also be sufficient. You look for we're going to look for that provider or practice name, which it shows provider in here. We're going to look for that date. We're going to look for that their current, like what active engagement option are they in, 1, 2, or 3. And then we're going to make sure that date lines up and is sufficient to meet. Moving on to measure 2, syndromic surveillance reporting. We also have that overview slide again, so you can go through and walk through the steps to see where does your EP that you're attesting for fall into. We're going to go through the exclusion route, so say that the measure was not met, so they can't submit data to syndromic surveillance. So then you go down to exclusion results, and you go to the left, and it shows met because there's 3 different exclusions. As discussed and mentioned previously, the EPs in the state of Arizona can claim the exclusions for syndromic surveillance because EPs are not able to submit data to that registry. Syndromic surveillance consists of receiving inpatient and emergency department data in a timely manner so that public health can use pre-diagnostic clinical data to understand what is happening in the community. Syndromic surveillance is a public health measure available for hospitals in Arizona. ADHS is not accepting syndromic surveillance messages from EPs. So if the EP works at a hospital, he or she is able to contribute to the Syndromic Surveillance Reporting Registry. If the EP does not work at the hospital, he or she is not able to contribute data. The following EPs could potentially meet the measure. This list is not all-inclusive. The first example is EPs working for a hospital that also owns an outpatient clinic and has the same cert. EPs working in a hospital that have their own cert, or EPs working at IHS using RPM cert. So keep in mind there are a few examples of EPs being able to meet the measure for syndromic surveillance in Arizona, but it is very rare, and those EPs do need to be connected with a hospital to submit that data. As you can see, no changes occurred between program year 2019 and program year 2020. So an EP may take an exclusion for measure 2 if any of the following apply, and there's 3 exclusions. The Arizona Syndromic Surveillance Reporting Registry only accepts data from EHs, not EPs. So for exclusion 1, which is an EP not in a category of providers from which ambulatory syndromic surveillance data is collected by their jurisdiction, the EPs in Arizona meet this requirement of the exclusion. For the second exclusion, it's when an EP practices in a jurisdiction for which no public health agency is capable of receiving that data. And so an EP in the state of Arizona is able to meet that because the Syndromic Surveillance Registry in Arizona is not accepting data from EPs. Exclusion 3 is also met by EPs in the state of Arizona. It is when an EP practices in a jurisdiction where no public health agency has declared readiness to receive syndromic surveillance data from EPs as of 6 months prior to the start of the PI reporting period. And this is true for the state of Arizona for EPs. Documentation for this measure is very similar to the Immunization Registry. The documentation submitted should include 4 things. The provider or practice name. It should reflect the EP's level of active engagement. It should be clearly legible, and it should reflect the date the requirement was met. For the exclusion documentation, for all 3 exclusions, so since all EPs in the state of Arizona are able to meet all 3 exclusions, no documentation is required. Just make sure when you're attesting that you document that you're taking one of those exclusions. Here's an example of if you were an EP working at a hospital, so you did submit data and you want to show that you meet the measure for syndromic surveillance. This is a letter from the Arizona Department of Health Services. You can see their logo at the top. And then, so this is just a template of what might be submitted by the hospital, but basically Arizona Department of Health Services would send this letter to you, and it would show the hospital name on it, and you would just need to confirm or identify that the EP works for that hospital, and so therefore they're submitting syndromic surveillance data. Moving on to electronic case reporting, there's an overview slide. It shows that you can meet all 3 exclusions potentially by the EPs in the state of Arizona. So this is going to kind of, again, walk you through, are you going to meet the measure for this one? Are you going to take an exclusion? Or should you select another measure to meet for the requirement? So electronic case reporting is the automated generation and transmission of case reports from the electronic health record to public health agencies for review and action. No changes occurred between program year 2019 and 2020. An EP may take an exclusion for Measure 3 if any of the following apply. The Arizona Electronic Case Reporting Registry is not accepting data from EHs or EPs. So this is very similar to the Syndromic Surveillance Registry in that the EP in Arizona can meet all 3 exclusions automatically because there is no electronic case reporting currently accepting data. So again, those exclusions are very similar to measures 1 and 2. Exclusion 1, the EP does not diagnose or directly treat any reportable diseases for which data is collected by their jurisdiction. Exclusion 2, he or she practices in a jurisdiction for which no public health agency is capable of receiving electronic case reporting data in a specific standards required. And then the third exclusion, which is the EP practices in a jurisdiction where no public health agency has declared readiness to receive electronic case reporting data as of 6 months prior to the start of the PI reporting period. So documentation for electronic case reporting, we don't have any documentation requirements listed for this because no EPs in the state of Arizona can meet the measure. For the exclusion documentation, because the EP automatically is allowed to take that exclusion in the state of Arizona, no documentation is required because we already know that the registry is not accepting data. Moving on to Measure 4, Public Health Registry Reporting. There is another overview slide helping you walk through the steps of should the EP use this as a measure. Keep in mind, if you go down to the center of the page, it's going to show those 3 exclusions. The EP does not diagnose or treat, the registry is not accepting data, and that shows that third exclusion, readiness not declared. This is when the registry has not declared that they are ready to accept data. This exclusion is not available because there are multiple public health registries out there that have declared readiness to accept data. Now the EPs in the state of Arizona must now determine are they able to submit data if they're collecting that data? Are they seeing those types of patients? Are they, for example, the cancer registry which Arizona has, is that EP seeing those cancer patients? They have that data to submit to that public health registry. So public health registry is administered by or on behalf of a local, state, territorial, or national public health agency and which collects data for public health purposes. The Arizona Cancer Registry is currently the only state public health registry. There are multiple national registries available, so you can contact your national specialty society. So if you specialize in diabetes, you can reach out to that society and ask them if there are any public health registry that you would be able to submit data to. You can participate in the National Healthcare Survey, and that is a link right there that you can click on. It's going to take you to the CDC website where you can apply to submit data to the National Healthcare Survey. That would count as one of your public health registries and is an easy one to do. At the very bottom of the slide, it talks about the list of public health registries under the National Institute of Health. So there's another list of public health registries that you could potentially submit data to, so make sure to click on that link as well to try to find that registry. And keep in mind, we're providing all of this data to you because it's easier to meet, potentially it's easier for you to meet 2 measures and submit data to 2 different registries than for you to meet the exclusions for all 5 measures, because keep in mind, if you take an exclusion for one measure, you have to take an exclusion or meet the measure for the remaining measures underneath this objective. So EPs may choose to report on up to 2 public health registries and have each registry count towards the total of 2 measures required by the objective. An EP may count a specialized registry if the EP achieved active engagement option 3 in a prior year under the applicable requirements of the PI program for that year. In Modified Stage 2, 2018, all public health registries and clinical data registries were included in the Specialized Registries measure. However, in Stage 3, which is program year 2019 and beyond, the Specialized Registry measure was separated into two measures, the Public Health Registry, which we're currently talking about, and then the Clinical Data Registry, which is the next measure we'll talk about. If a Specialized Registry is public, so state or federally run, rather than private, it should be classified as a public health registry. The Prescription Drug Monitoring Program was not an available registry for the state of Arizona in program year 2020. No changes occurred between program year 2019 and program year 2020. So let's talk about the exclusions for the public health registry. Exclusion 1, he or she does not diagnose or directly treat any disease or condition associated with a public health registry in his or her jurisdiction during the PI reporting period. Exclusion 2, he or she practices in a jurisdiction for which no public health agency is capable of accepting electronic registry transactions in the specific standards required to meet the CERT definition at the start of the PI reporting period. And exclusion 3 is he or she practices in a jurisdiction where no public health agency for which the EP is eligible to submit data has declared readiness to receive electronic registry transactions as of 6 months prior to the start of the PI reporting period. Documentation for public health registry reporting. So for active engagement documentation, it should include those 4 things. It should include the provider or practice name. It should reflect the EP's level of active engagement. It should be clearly legible, and it should reflect the date the requirement was met. The exclusion documentation for exclusion 1, the document should explain why the EP does not or is not required to collect public health data in his or her jurisdiction. So you want to be able to write it on a practice letterhead, explain your reasoning for why you believe the provider meets exclusion 1. The documentation for exclusions 2 and 3, an EP must complete 2 actions in order to find available public health registries. So an EP can't just say, oh, I don't think I have any public health registry that I meet. I can't submit data. There are no registries for me to submit data to. You need to be able to document why, and you need to follow these 2 steps to make sure. So you need to determine whether the EP's jurisdiction endorses or sponsors a registry, so reach out to the cancer registry, or document and explain on a practice letterhead why your EP does not see, just that your provider does not see cancer patients or does not meet one of the specialty types that are allowed to submit data to the cancer registry. But more than just that state level, you need to, that last bullet point, determine whether a national specialty society or other specialty society, so it could be regional, it could be any level, with which he or she is affiliated, endorses or sponsors a registry. Keep in mind, we did provide you a list, the National Health Survey Registry, we provided you a list of other registries that the EP can potentially meet. So go in there and look through those registries and then explain, hey, I looked through this list and there were no registries because my provider, for example, does not see diabetes patients or cancer patients. Make sure you're documenting that and explaining your reasoning why you meet these exclusions. Here's an example of meeting the measure. So this is for the National Healthcare Survey Specialized Registry, which is now a Public Health Reporting Registry. And so as you can see, we've blacked out the parts, we redacted the parts that list the specific practice that this applies to. But this would be an example from that registry of your practice potentially meeting the requirements of this measure. You want to ensure documentation includes the items listed on slide 13 and is dated appropriately. So make sure it has the date on there. Make sure it identifies your practice name. Make sure it identifies what public health registry it was that you were submitting data to. Moving on to Measure 5, the Clinical Data Registry Reporting. Again, here's the overview slide again to kind of figure out, should you use the Clinical Data Registry as one of the measures to meet for your provider? All 3 exclusions are available for this measure, which we will walk through in a few minutes. Again, if you do not meet the measure or you do not meet the exclusion, make sure you're looking at the other measures to see which ones are easier or more easily met, potentially. Okay, so a clinical data registry records information about the health status of patients and the health care they receive over varying periods of time. Clinical data registries typically focus on patients who share a common reason for needing health care. There are multiple clinical data registries available. There may be additional registries that are not included on this list. As you can see at the very bottom, there's a hyperlink, and it's the CMS-approved Quality Clinical Data Reporting Registries for 2020. So again, we've provided a list of clinical data registries where potentially your EP can submit data. So start there, see if any of those registries will accept data from your provider. An EP may count a specialized registry if the EP achieved active engagement option 3 in a prior year under the applicable requirements of the PI program for that year. As discussed briefly earlier in the presentation, in modified stage 2, which was in 2018 and prior, all public health registries and clinical data registries were included in the specialized registries measure. However, in stage 3, in program year 2019 and beyond, the specialized registries measure was separated into 2 measures, the public health registry and then this measure, which is the clinical data registry that we're talking about. If a specialized registry is private rather than public, it would be classified as a clinical data registry. EPs may choose to report on up to 2 clinical data registries and have each registry count towards the total of 2 measures required by the objective. No changes occurred between program year 2019 and program year 2020. Let's discuss the exclusions underneath this measure. So exclusion 1, he or she does not diagnose or directly treat any disease or condition associated with a clinical data registry in his or her jurisdiction during the PI reporting period. Keep in mind that for jurisdiction that can be broad. It can be state, it can be regional, or it could be national level. Exclusion 2, he or she practices in a jurisdiction for which no clinical data registry is capable of accepting electronic registry transactions in the specific standards required to meet the CERT definition at the start of the PI reporting period. Or, for exclusion 3, he or she practices in a jurisdiction where no clinical data registry for which the EP is eligible to submit data has declared readiness to receive electronic registries transactions as of 6 months prior to the start of the PI reporting period. Documentation for clinical data registry reporting. For the active engagement documentation, it should include those 4 things. Provider or practice name, it should reflect the EP's level of active engagement. It should be clearly legible, and it should reflect the date the requirement was met. And keep in mind that the date the requirement was met changes depending on if it's active engagement option 1, which is registration, if it's 2, which is testing and validation, or if it's active engagement 3, which is production. Moving on to exclusion documentation, the EP should explain and document why they do not or are not required to collect clinical data in his or her jurisdiction. So again, write up a letter explaining that. For exclusions 2 and 3, an EP must complete those same 2 actions discussed for measure 4 in order to find available clinical data registries or meet an exclusion. So that first step is to determine whether his or her jurisdiction endorses or sponsors a registry. And 2, determine whether a national specialty society or other specialty society with which he or she is affiliated endorses or sponsors a registry. A lot of times EPs do get confused with these 2 steps and how to show that, and to make because usually the prepayment or postpayment auditors do reach out to the EPs and request additional documentation. So make sure you're just writing out an explanation, whether it be an email or on the practice letterhead, explaining and saying, hey, I took these steps. I reached out to this society and asked them, and they said there is no registry that I can submit data to because of the types of patients I see. Make sure you're documenting that and explaining it before you go in and attest that you take that exclusion. So go ahead and submit that data during attestation to make sure that you cover your bases and just explain it all and provide what documents you can. Here's an example of the DARTnet Institute, which is a clinical data registry. And so the DARTnet Institute is right here saying that this practice in 2019 and 2018 as well, was submitting data to their organization. So it shows the original registration date, which was back in 2016. So this EP could have used this document for program year 2016 if that was prior to the PI reporting period, because as you can see, October 11th, 2016, which you have to be registered within 60 days of the start of the PI reporting period. So the EP could have claimed this document potentially for program year 2016 as support, program year 2017, 2018, 2019, in the beginning of 2019. So it's showing that date in January 14th, they were still active in active engagement option 3. So they've been submitting data. Let's go over to some key takeaways. That was a lot of information that we provided to you. Keep in mind that this presentation was recorded and will be put on the Access website. So you can go back and listen to different things. If you have additional questions, I will be taking questions at the end of this presentation if we have time. And we'll also be providing you a list of contacts for if you do have any questions specifically related to each registry. So best practices. Check the following before reaching out to ADHS contacts listed at the end of this presentation on slide 66. So you want to save documentation and communication between the EP or practice and the relevant public health agency or clinical data registry. Ensure that documentation includes the information listed on slide 13. So the provider or practice name, the date that's clearly legible. Make sure you're looking at these slides and saying, hey, does my document meet the requirements? You want to review the information on the ADHS website, and that's a hyperlink, so it's going to take you straight to the ADHS website to look at what is available in the state of Arizona. Keep in mind that ADHS is working on updating their website for Stage 3 requirements, so please contact ADHS for specific Stage 3 questions. The EP should contact the appropriate registry in a timely manner. EPs may utilize the contact information on slide 66 to request confirmation of the following: the level of active engagement that the EP is in, and the date the EP or practice entered applicable level of active engagement. So if you are wondering when the EP first registered, you can reach out to ADHS and say, hey, when did this provider register for submitting data to the Immunization Registry? Keep in mind, for Measure 1, which is the Immunization Registry, that the EP must have been submitting data bidirectionally. So that needs to be implemented and implemented within 60 days of the start of the PI reporting period. If the EP is not submitting data bidirectionally, then that immunization measure cannot be used by the provider for Stage 3. Available registries in Arizona, as you can see, for Immunization Registry, there is the Arizona State Immunization Information System, and the EP must be actively engaged in exchanging data bidirectionally to meet the measure. There is no second registry available for immunization. For syndromic surveillance and electronic case reporting registry, there are the registries are not available to EPs. For electronic case reporting, it's not even available to EHs for them to submit data. For public health registry reporting, Arizona does have the cancer registry. It's only available to EPs with the specialties listed at the very bottom of the slide, who diagnose and treat more than 100 cancer cases per year. So keep that in mind. That is a requirement to submit data there. Under Available Registry 2 column, you can see that the EP should research national public health registries related to their specialty. For the clinical data registry reporting, EPs should look at that list, that hyperlink of the CMS-approved quality clinical data reporting registries for 2020 to see if that EP can submit data to any of the registries listed on that list. There are other registries beyond what we have listed and referenced throughout this presentation, so keep that in mind. If you find another registry, then you can go and submit data to that registry and it would count. If you have concerns of whether it's a public health or a clinical data registry, try to figure that out. Again, feel free to reach out to Access and ask any questions or concerns that you might have. Keep in mind for the public health registry reporting and the clinical data registry reporting, an EP may choose to report on up to 2 registries and count each registry to meet the 2 measures for the objective. So for example, for the public health registry, if you have a specific provider submitting data to 2 different public health registries, that counts as the EP submitting data to 2 registries, and therefore they would meet this objective. Here's a summary of the appropriate documents that are needed for registration. There's a few examples listed underneath there. So an email confirmation from ADHS Public Health MU portal, or an email or letter from ADHS with the status of where the EP is at. This also goes along with any national registries. If you have an email from the registry confirming you are registered, that would be sufficient as well. For testing and validation, it can be email communication with ADHS or any other national registry. Onboarding, meeting notes, potentially acknowledgments of messages received for testing, or an email or letter from ADHS with the status of where that EP is currently, or at some point in the past. Production, it could be email communication with ADHS or any registry when the EP is in production. Production acknowledgments of messages received, a submission report potentially, and an email or letter from the registry with the status. Examples of all the documents listed above were identified in the ADHS Public Health webinar. So ADHS did a public health webinar with Myers and Stauffer, and that link would take you to that presentation. It has additional examples of other documents specifically related to the state of Arizona and what registries ADHS is in charge of. So definitely check that webinar out. So let's discuss just some audit findings. So what happens during an audit? All providers that receive a Medicaid PI incentive payment could potentially be selected by Access for post-payment audit. If selected, Access post-payment analysts will conduct a thorough review of the documentation attached to the EP's attestation and EPIP to determine if it meets the program requirements. Access may have follow-up questions or make additional documentation requests. Some common audit findings, so supporting documentation does not show the EP or practice name. The documentation does not have the appropriate dates on it, or for Measure 1, does not show the EP was exchanging data bidirectionally. So you're submitting data and you're querying that data. Another common example of document felony is when the EP attests to meeting an exclusion but does not have supporting documentation to support that exclusion. And then the last one is not uploading the supporting documentation during attestation. So make sure you're uploading and documenting everything and submitting it all during attestation. Here are some resources that we use to put together this webinar and that we have created to help you all better understand the public health objective. As you can see, we have referenced the CMS Objective 8 tip sheet, the federal final rule for modified stage 2 and stage 3, the ADHS website, which has the specific Arizona registries, also the National Institute of Health Registries, which we referenced earlier in the webinar, the CDC Public Health and Promoting Interoperability Program, so the list of registries for that. Also, the link for where you'll find this webinar, which is the Promoting Interoperability and ADHS Public Health Reporting Registries webinar. So those last two links take you to the Access website, where you can find the webinar for public health reporting, and the last link, which is the frequently asked questions. So we put together a list of questions that we thought you might have and the answers for those questions. So you can always go there if you think one of those questions might be listed already and we've already provided an answer for it. Here is a list of contact information. So as you can see, all the agencies are listed and then help with. So that first row talks about ADHS and the Immunization Registry. Who do you email for that registry and what their phone number is. And it goes through for each of these registries. At the very end, it does have the Access PI program team email, so the EHR incentive payments at ArizonaAccess.gov, and also the phone number. So if you have any questions or concerns about whether documentation might be sufficient for an audit, please feel free to reach out to that team and just ask them ahead of time and let them know that you might have some concerns, and we will get back to you regarding that. So I know we only have a few minutes left. If anyone has any questions, please feel free to put it in the chat box so we can get those questions and help you to understand this objective better.
Sarah, do we have any questions in the chat box?
Not yet.
All right, let's give them just a few minutes.
And keep in mind that on the contact slide, if you do have questions after the presentation is done, feel free to send an email or a call, these numbers listed. in regards to any questions you have. And again, check out the resource slide that has all the different hyperlinks to different websites and the frequently asked questions. As people are thinking through all of this information, I know it was a lot. I'm going to pull the frequently asked questions document that we prepared and is available to you all. So here's the frequently asked questions document. We've provided it to you in PDF, and you can go through. There are 6 pages of questions throughout it. So the first question is, how does an eligible professional meet the public health and clinical data registry reporting objective? The answer is an EP must satisfy 2 of the 5 available measures listed below for this objective. If the EP cannot satisfy at least 2 measures, the EP may still meet the objective if the EP qualifies for exclusions from all measures the EP cannot meet. And then it lists those different measures: immunization registry, the syndromic surveillance reporting, electronic case reporting, public health registry, and the clinical data registry. And we'll just skip a few questions. So what determines an EP's jurisdiction? The definition of jurisdiction is general, and the scope may be at the local, state, regional, or national level. The definition will be dependent on the type of registry to which it is reporting. Keep in mind that a registry is borderless and would be considered reporting at the national level and would be included for purposes of this objective. Are there any questions as of yet?
No questions in the chat at the moment.
Okay.
Actually, we do have one in chat from Crystal Collier. She's asking if she can say something real quick. So let me find her line and unmute her.
Perfect. And for those of you that do not know, Crystal Collier, she works with Arizona Department of Health Services. So if y'all do have questions, she is available to help answer any questions regarding the different Arizona-specific registries.
And I'm not seeing her line. Oh, there we go. All right, Crystal, you are unmuted.
Thank you. Yes, my name is Crystal Collier, and I help run our help desk to respond to all the promoting interoperability questions for the public health registries here in Arizona. Just as a request to be helpful to us right now during this time of COVID, that if you do have questions, I would highly encourage you to submit them via email. You can still call, but right now I think everyone is incredibly busy. So we will take your questions and we will respond them, but we ask if you could please submit them by email. It would do us a lot of good to be able to triage some of those through email right now. And just want to thank you, Priscilla and team, for your presentation today, and encourage folks, if they do have questions, to look at all the resources and don't hesitate to ask questions, whether it's after today's presentation or just something else that comes to mind and you want to clarify if something has changed in the rules or something for the status of whether our registries are available or what the requirements may be to work with us. We're always happy to work with you all and just really encourage communication between partners. It helps all of us out, and want you to feel supported and our availability to respond to questions you may have.
Thank you so much for that, Crystal. Again, if y'all have any questions, please feel free to send those emails and reach out to us. Are there any last-minute questions? I know we're getting a few minutes, towards ending, about a minute out from closing out the webinar. If there are any questions, please feel free to put those in the comment box. We're happy to answer any questions that you have.
One question on where to find the slides, but we'll review that here when we conclude.
Okay, perfect. And since while we're waiting for some questions, I could go ahead and show y'all how to, with the resource slide, you can go and click on these hyperlinks. And so if I open up one of the webinar hyperlinks, it's going to take us to that Arizona website. which has all the webinars we have all the objectives covered to this point for program year 2019 for stage 3 and most of them for 2020. When you click on that link and you come down here to educational resources, it has multiple webinars, and give them and program year 2020 objective 8 public health and clinical data registry reporting presentation will be posted here on the Arizona website, and I know that Health Current also posts these webinars on their website as well.
Connie, is there anything you'd like to add before I go over the statistics?
Yes, I do. First of all, thank you to Priscilla for all she's put together for this webinar and for her wonderful presentation about it. Very much appreciated by everyone on the call as well as any participants in the program. I do have a special announcement to make. There will be a special edition. Priscilla, can you maybe mute your line? I'm not sure. Someone's line is causing lots of noise here.
I've muted her.
Okay. All right, perfect. Okay. Also, if there's anyone else who's on the line that doesn't have their line muted, please do so. There's lots of noise going on. Thank you. I want to announce that there's a special edition of the newsletter coming out, and that will be on Tuesday the 22nd. Couple things that will be in that newsletter that I think you'll all be very interested in. First of all, there will be a webinar next week on the 24th, which is Thursday, and that webinar will be about the HIE Exchange Summary of Care instructions for referrals and transitions of care via the HIE. So those of you that are interested in learning about that, if you are now a participant in the HIE, great, you want to for sure join this webinar. If you are not a participant in the HIE, but you're thinking about it, you might want to join. Remember, it doesn't cost anything to belong to the HIE. If you have any questions about it, you can call the Health Information Exchange, or you can email them at hie@healthcurrent.org, and you'll get more information about it. But I encourage you to register for that webinar. Also, ONC has announced 4 sessions next week for the new features of the SRA 3.2 tool. So there's 4 sessions next week. There's one on the 21st, the 22nd, the 24th, and the 25th. And I will include with the email that I send after this webinar, that will include the 2 copies of the slide decks that Priscilla used today and the FAQs. Will also include this specifics on these additional trainings for the SRA tool, so you can get registered and get going on it. So if you have any questions about that, please let me know. Again, there's watch for on Tuesday, a special edition of the newsletter announcing the SRA, as well as the webinar that will be next week. And that's all I have, so go ahead, Sarah, and make your final announcement.
Okay. For each of you who have registered for today's meeting and have participated in today's webinar, you're going to receive a copy of the webinar slide deck and the questions and answers that were addressed during the call. So this call has been recorded and is going to be posted along with the questions and answers to Access's and Health Current's websites. So this concludes today's webinar. Thanks to Access for sponsoring the presentation today, and thanks to all of you for participating. And I hope you have a wonderful rest of your day. Thank you.